Hi, my name is Lauren Fallensby. I'm an occupational therapy student, and today I'll be going over how you as a caregiver can administer the manual muscle test at home. The manual muscle test is a standardized assessment that allows clinicians, such as occupational therapists, to measure and track a client's strength for various muscles throughout the body. Today, however, we're going to focus on just the upper body. On the manual muscle test, the scores range from 0 to 5, 0 being the weakest and 5 being the strongest rating. Learning how to administer this assessment at home will give clinicians, such as your OT, a way to measure and track progress via telecommunication, as well as assess if the client is meeting goals. So for general positioning, we'll usually start sitting in a chair or lying on a couch or sitting at a tabletop, with knees generally at a 90-degree angle if you're sitting in a chair, feet flat on the ground, chest straight and upright, no leaning against the back of the chair, and just generally no other abnormal movements or compensations. So just a general overview of the steps. First, we will be asking the patient to move against gravity and to hold the position. If the patient can hold the position, then I will be asking you as a caregiver to give medium resistance. If they can tolerate medium resistance, then you can go ahead and give strong resistance. If the patient cannot move against gravity, then I will be asking you to change to a gravity-eliminated position. And then I will ask the patient to move the full range, and if the patient cannot move the full range, then I will ask you as the caregiver to feel or palpate the muscle to see if it's contracting. So the first action that we're going to do is shoulder flexion. So I'm going to simply ask my patient to lift his arm up out in front of him and hold it there with his thumb up. Now I'm going to provide some medium resistance, and if he's able to tolerate that, then I'm going to apply strong resistance, and notice I'm doing this close to his body. If my patient is unable to raise his arm against gravity, then I will ask him to get in a side-lying position, either on the floor or on the couch, which might be a little bit more comfortable. And then I'll ask him to raise his arm up all the way towards his head with his thumb pointing up. Okay, and then if he's not able to do that motion, I'm going to just say, please try to lift your arm up with your thumb pointed up towards your head. And if you can't do that, I'm going to palpate the muscle at the front of the shoulder to see if I feel that muscle contracting at all. And then you would let your therapist know if you feel that muscle's contracting or not. And for this next one, shoulder abduction, I'm going to tell my patient with his thumb up to bring his arm out to the side and to hold it there. When it's at that 90 degrees, I'm going to again provide just some medium resistance. And then if he can tolerate that, I'm going to also provide strong resistance. If my patient is not able to move his arm out to the side against gravity, I'm going to put my patient laying on his or her back on the couch or on the floor. And then I'm going to ask him to bring his arm out to the side with his thumb up. Okay? And if he's not able to do that movement, then I'm going to ask him, can you bring your arm out to the side? And then see if there's like any slight movement, or again, palpate or feel on the side of his shoulder. And then if you do feel some sort of palpation or movement of the muscle, then you would let your therapist know that you feel that. For the next movement, I'm going to ask my patient to keep his elbow straight and bring his arm back behind him, and then hold that position. Once he holds the position, I'm going to apply a medium amount of resistance, and then if he can tolerate that, I'm going to apply some strong resistance. My patient cannot bring his arm behind him against gravity or in the sitting position. I'm going to ask him to lay on his side on a couch or on the floor, and then keep his elbow straight and bring his arm back behind him. If he is not able to do this motion, I'm going to ask him, please bring your arm back behind you. And then I'm going to palpate for a contraction in the back of the shoulder area. And if you feel any sort of contraction or slight movement, let your therapist know. Okay, so for this action, external rotation, I'm going to ask my patient to start in kind of like a box-like position, a 90-degree angle, and then I'll ask him to make his arm like a door hinge and bring his arm up towards his head. All the movement should be happening at the shoulder. And then if he's able to do that motion, then I will provide some resistance lightly at the forearm, and I'll apply moderate resistance and then strong resistance. If my patient is not able to rotate his arm outward against gravity, then I'm going to ask him to stay seated, put his arm in that 90 degrees, and then bring his arm out to the side like a door hinge. If he is not able to do that movement, I'm going to ask him, rotate your arm out to the side, and I will feel on his shoulder blade if there's any movement or any palpation or contraction. And then you would let your therapist know. For this next movement, internal rotation, we're going to start lying on his back again on a couch or on the floor with his elbow in that 90-degree angle again, and keeping his arm and elbow like a door hinge. He's going to move at his shoulder and bring his arm towards his body. And if he can do that, I'm going to apply a little bit of resistance at his forearm. He's going to resist. I will also support at the arm. And then I'll provide medium resistance and then strong resistance. My patient is not able to bring his arm in towards his stomach against gravity, then I'm going to have him sit in a chair and keeping his elbow in that 90 degrees, bring his arm towards his stomach. If he's not able to do that, then I'm going to ask him, please rotate your arm towards your stomach, and then see if I can feel any movement again on his shoulder blade. So he wouldn't be moving. And then you would let your therapist know if you feel any movement or contraction on the back of his shoulder blade. For the next movement, elbow flexion, I will be asking my patient to put his palm up and bend his elbow with his hand up towards his shoulder. If he can do that movement, then I'm going to be applying a little bit of resistance at the forearm, so medium resistance and then strong resistance. Patient can't bend his elbow in the against gravity position sitting, then I'm going to put him side lying on the couch and ask him to bend his elbow. If he cannot bend his elbow, then I'm just going to palpate at the biceps tendon, so like the front of his arm, and see if I can feel any sort of movement or contraction, and you'd let your therapist know. Then for this movement, we're actually going to start with his elbow bent, and I'm going to ask him to straighten his elbow. Okay, do it a couple times. And if he can do that, then I'll ask him to hold here, and I'll say, push against me. And I'll do a medium amount of resistance. If he can do that, I'm going to do strong resistance. My patient is not able to do the elbow extension movement or straightening his elbow against gravity, then I'll have him go inside lying on the couch or floor and ask him to straighten his elbow. So to go from bent to straight. And if he cannot do that movement, then I'm just going to feel at the triceps and see if there's any movement. I'll palpate and see if there's any contraction. So for this movement, supination, we'll start at tabletop, and then my patient will start with his palm facing down, and I will ask him to turn his palm up towards the sky. If he can do that motion, then I'm going to be providing resistance. So I will say again, turn your palm up towards the sky, provide medium resistance, and then strong resistance. Patient is not able to turn his palm up against gravity, then I'll have him get in a position where his elbow is on the tabletop, and he will start with his palm facing away from him, and then I will ask him, turn your palm towards you. Okay, and if he is not able to do that, then I will palpate at the elbow and see if I feel any movement. The thumb side of the elbow, I will palpate. So right here. So just like for supination, for the pronation movement, I will have my patient sitting at the tabletop with his palm facing up, and then I will ask him, please turn your palm down. If he is able to do that movement, then I will be providing resistance, so basically just grabbing like a handshake, and I will be resisting him. So I will be trying to turn his palm up, providing medium resistance, and then strong resistance. If the patient is not able to turn his hand against gravity, then I'm going to ask him to put his elbow on the tabletop, start with his palm facing towards him, and then turn his palm away from him. If he is not able to do that movement, I will ask him, please turn your palm away from you, and then I will palpate at the inner side, the pinky side of his forearm by his elbow. For this next movement, wrist flexion, we're going to start at the tabletop again, and I'm going to ask my patient to bend his hand towards him. Okay, and then if he can do that movement, I will grab across his hand and be providing resistance. So I'll say, bring your hand up towards you, provide medium resistance, and then strong resistance. If the patient is not able to bend his wrist against gravity, then we will change his position to neutral, so sideways, and then I'll ask him to bend his wrist towards him. If he's not able to do that movement, then I will palpate at his forearm and see if I feel any movement or contraction. For wrist extension, we will also be at the tabletop, this time with my patient's palm facing down, and I will ask him to bend his wrist towards him. If he is able to do that movement, then I will be applying resistance on the back of his hand. So medium resistance, and if he can tolerate that, strong resistance. If my patient is not able to lift his palm off of the table, I will ask him to go in neutral, so sideways, and ask him to bend his wrist away from him. If he cannot do that movement, then I will palpate or feel at the back of the forearm to see if I feel any contraction. Okay, and then for finger flexion, I'm going to ask my patient to again put his arm and hand palm up on the table, and I will ask him to make a fist. If he can make a fist, then I'm going to ask him to squeeze my fingers, and then you will determine if it's a light squeeze or a strong squeeze and tell your therapist. If my patient is not able to make a full fist against gravity, then I'm going to move and reposition him towards neutral, so sideways, and then ask him to make a fist. If he cannot move at all, then I'm just going to palpate on his palm to feel if there's any movement or contraction. And then you would let your therapist know if you feel contraction. Last movement, finger extension, I'm going to support at the patient's forearm and ask him to open his hand. So starting in a closed fist and then opening his hand. If he's able to do that, I'm going to ask him to stay in a fist, and I'll put my hand over the top to provide resistance and ask him to open up his hand. So medium resistance and then strong resistance. If the patient is not able to open up his hand against gravity, then I will ask him to go in neutral position, so hand sideways, and then asking him to open up his hand. If he's not able to do that, I'm going to feel the back of his hand by his knuckles to feel if there's any contraction. And then you let your therapist know if there is or isn't. I went through and did a manual muscle test on most of the important muscles of the upper body. So you would be doing this through telehealth with your therapist watching, and you would kind of relay the information based on the different steps that we did for each muscle group and action. You would relay that information to your therapist, and your therapist would ultimately be doing the scoring and the assessment. Thank you for watching my video.